Everyone talks about sugar and weight gain, diabetes, or heart disease. But almost nobody ever warns you about what sugar is silently doing to your eyes. If your vision is blurry, flickering, or you're suddenly seeing odd spots, this could be your blood sugar levels attacking your vision. And you need to hear this now. Hi, I'm Dr. Vitalis, and today I'm going to walk you through a topic almost no one talks about: how sugar affects your eyes long before you even develop full-blown diabetes. Medical research makes it clear that high blood sugar can damage the tiny blood vessels in your eye's retina, the part of your eye that turns light into vision. Rather than cosmetic issues, we're talking about real, measurable risks, backed by studies from leading institutions like the National Eye Institute and the CDC. To understand why sugar can harm your eyes, we have to start with blood glucose. When sugar stays high in your bloodstream over long periods, it damages the smallest blood vessels throughout your body, including those in your retina at the back of your eye. These delicate vessels can weaken, leak fluid, or even close entirely, starving retinal tissue of nutrients and oxygen. In fact, diabetic eye conditions like diabetic retinopathy, the leading cause of vision loss in working-age adults, develop when these vessels break down. People with long-term high glucose levels are many times more likely to develop serious eye damage than those with controlled levels. And here's a critical point. It doesn't only happen in full diabetes. Even frequent spikes in blood sugar, such as after a sugary meal, can stress your eyes over time. That's why the link between sugar and vision isn't just theoretical. It's clinically proven. Now let's talk about one of the earliest warning signs most people miss: blurry vision. Chronic high blood sugar actually causes the lens inside your eye to swell and change shape, making it harder for your eyes to focus clearly. Researchers at the National Eye Institute report that this swelling can make your vision seem foggy or out of focus, and it often gets mistaken for needing new glasses rather than a sugar-related eye issue. Here's another silent effect sugar can have: early cataract formation. Normally, cataracts develop slowly with age, but studies, including those referenced by the Mayo Clinic, show that people with prolonged high glucose levels often form cataracts years earlier than average. The excess sugar alters the proteins in the eye's lens, causing it to become cloudy. This not only blurs vision further, but also makes bright lights and night driving harder to tolerate. One of the more serious changes sugar can trigger is macular edema. Swelling in the macula, the part of the retina we use for sharp central vision. According to eye health specialists at the American Academy of Ophthalmology, high blood sugar weakens tiny retinal blood vessels, causing them to leak fluid into the macula. When that happens, straight lines can look warped or wavy, colors dull, and tasks like reading or recognizing faces become harder. This is not a normal blurriness. It's a warning sign of deeper retinal damage. As high blood sugar continues to stress your eyes, more subtle changes can begin, starting with floaters. These look like tiny specks or cobwebs drifting across your field of vision, and they're often caused by microscopic bleeding inside the eye when fragile vessels leak or break. But that's just the start. In more advanced cases, your retina may actually try to grow new blood vessels to compensate, a process doctors call neovascularization. Unfortunately, these newly formed vessels are weak, prone to bleeding, and can signal the onset of diabetic retinopathy, the leading cause of vision loss among adults ages 20 to 74, according to the CDC. These changes are not harmless floaters. They're a red flag that deeper retinal damage may be happening behind the scenes. Now we're entering the most serious territory, when sugar-related damage isn't just annoying, but dangerous. Persistent high blood sugar can trigger scar tissue formation and pull the retina away from the back of the eye, a condition called retinal detachment. This isn't reversible with glasses or rest. Without urgent treatment, it can permanently rob you of vision. And that's not all. Elevated glucose in your tears and ocular surface increases your risk of infections and ulcers, from eyelid styes to infections of the cornea. because high sugar impairs the eye's natural defenses. Research published through the American Academy of Ophthalmology shows that nerve damage can also occur, slowing healing and making even minor eye injuries harder to recover from. This combination, scars, infection risk, and nerve dysfunction, underscores how sugar can undermine both the structure and function of your eyes. Here's what you need to remember. Occasional sugar isn't harmful, but chronic high blood sugar silently stresses your eyes over time. From blurry vision and cataracts to retinal detachment, the risks accumulate without warning. Even if your vision feels fine, annual eye exams are essential, especially if you have diabetes, prediabetes, or a family history of eye disease. Early detection can prevent irreversible damage, giving you control before it's too late. If you notice blurry vision, floaters, or any unusual changes, don't wait. See an eye doctor immediately. Comment below with your experiences or questions. I'll respond or cover them in a future video. Remember, a little sugar is okay, but awareness is power. Stay informed, protect your eyes, and make small daily choices that keep your vision clear for years to come.